C-SPAN's Q&A. Washington Journal continues.
Dr. Jake Deutsch joins us now for a conversation about the surge in COVID-19 cases nationwide and what it means for medical facilities on the front lines. He serves as clinical director and co-founder of Cure Urgent Care in Manhattan. And Dr. Deutsch, can you first just talk about what the last 4 months have been like for you and your staff there in New York?
Well, it's been interesting to say the least. My training is an ER doctor, so I did emergency medicine for 13 years and started an urgent care practice in New York about 6 years ago. And our bread and butter has always been the problems that are episodic: a sprained ankle, UTI, simple things that didn't require the hospital, but were in an intermediate kind of range. And we transitioned pretty quickly into a COVID center when the pandemic hit New York. So it was a lot of learning by fire, and we sort of strapped on our boots and jumped into helping because that's what was necessary. And we have treated over 10,000 patients, I would estimate, in the past couple of months. And we went from the real difficult times in March to now the much more calm times. And it's been an interesting journey, to say the least, definitely the highlight in my medical career. We were one of the first practices to be able to provide testing on a wide scale level in New York. We were very creative. We worked with independent labs, as was advised early on in the pandemic, and we got testing available. And while many people were unable to get tests in New York, frontline workers, healthcare providers, we were actually testing people and testing them frequently. And that was really a godsend for people who needed to know if they were sick, who were being told you should be working in the ICU even though you have fevers. We were keeping the people that needed to be healthy back on the front lines. And additionally, just seeing thousands of other people who were ill, who otherwise maybe didn't need to go to the hospital, or the few that we did need to send to the hospital, but just preventing unnecessary volume in the critical care settings. So really was just an incredible time for us. And, luckily, the worst of it seems like it's passed, but, it's been an evolution.
You yourself
Sorry.
were infected at one point?
Yeah, so before we knew about COVID per se in the United States, we were treating people who had flu-like illnesses that were testing negative for the flu. And, essentially, I could remember patients looking at me and saying, do you think that this is that coronavirus? And I said that, I can't tell you, I don't know. And we weren't being directed to be even wearing masks. I mean, that's just never been the standard in medical practice. Even in flu season, we get vaccinated for the flu and we treat people with, usual precautions, but wearing PPE was not the standard. So presumably got ill prior to any of the recommendations. I had heard about corona, obviously, as some of the news was making the forefront, and thought, wow, if it's a flu, I'd like to get it. I want to kind of just be done and get back to work to help people. I had no idea the extent of the illness in which I was going to suffer. I was sick for a total of about 16 days. The first week was bad. Week 2 hit. It was really bad. I checked myself into the ER and had bilateral pneumonia. So it was a real eye-opener in terms of what this virus could do. I'm healthy, I have no medical problems. And, I went from, doing everything that I had been used to, working out and working and, doing life's normal things, to laying in bed and being really scared, because having pneumonia on both sides can lead to complication. And certainly all of the respiratory symptoms that everybody was reporting was very scary. So, luckily did not have to be in the hospital, was able to take care of myself. But simultaneously had a father who was sick. He came down with COVID and ended up in the ICU and was intubated and on a ventilator. He subsequently recovered, but you can imagine this gamut of things happening with the practice that was trying to help out and, maintaining good standards, my own illness, my family's illness. So, in the heart of the pandemic in March, when New York was really getting hit, it was pretty tough times, I would say, personally and professionally. And, like I said, just learned so much. There's not a textbook that we were able to reference or journals to read about with COVID. It was really trial and seeing patients and communicating with other doctors, whether it was through social media or, consultations, just, chatting with people. So, really a unique experience as a professional, to be learning by basically being on the front lines and sort of sticking your neck out, and learning from personal experience.
Dr. Jake Deutsch with us this morning to talk about that unique experience and answer your questions about it and what he saw in Manhattan at Cure Urgent Care, and to talk about the spikes that we're seeing around the country right now. You can join the conversation this morning. Phone lines split up regionally. If you're in the Eastern or Central time zones, it's 202-748-8000. If you're in the Mountain or Pacific time zones, 202-748-8001, and then a special line for those who have experience with COVID-19, whether personally or a family member, 202-748-8002. Dr. Deutsch with us until the bottom of the hour at 9:30 Eastern this morning. Dr. Deutsch, I'm going to show viewers this chart in the Wall Street Journal today on the surge in coronavirus cases, but tracking how long it took the United States to reach its first, second, and third million cases. The first million cases took 95 days to rack up that many cases in the United States. And then 43 days later, we hit our second million cases in the United States. And then just 28 days later, we hit our third million cases in the United States. What's your biggest worry right now as we watch that surge and those spikes around the country?
I mean, it feels like we're losing control to some degree. And having seen New York gone through the worst of it, I don't wish that on any other country or any other city in the country. So that's scary. And as the resources become overwhelmed, then it gets really, really, really dangerous. So if you remember back in March, we didn't have PPE, we didn't have ventilators, we didn't have enough, support hospital staff to take care of it. And if we get into those situations in other parts of the country, we're really going to be moving backwards, and it's only going to precipitate greater numbers of cases and just a spiral that I think could be quite out of control. So that's the part that really worries me. We've seen that using PPE works. We've seen that social distancing works in New York. We reported the other day 0 deaths, the first time since the pandemic started. I mean, that's real progress. So we have to learn from that information. We have to take that and apply it to other parts of the country. And it's very scary that it doesn't seem that things are moving in the right direction. We see this huge slide of new cases. So, somebody needs to pay attention. We all need to be vigilant. It's really an individual problem. If we're not being told on the greater level what we need to do, everybody needs to take action individually, is my belief.
Who's the best person to deliver that message to try to get all of the country to learn the lessons that you went through back in March and April? Do you think this has become too political? Do you think doctors need to be out there more talking about their experience like you're doing?
Absolutely. If it doesn't affect you, it just doesn't resonate. So seeing somebody who was sick in New York 3 months ago has no bearing when you're in another state and you're trying to justify that you need to get back to work, or you want to gather with friends and family. Having a connection that really is personal is what's going to make the difference. So we need to keep reminding people that this is really out there and that this is what's happening. So it's the physicians, like you mentioned, of course, it's our leaders. They should be, the people guiding the ship here. But I really believe that influencing people who are young, who are relatable to the people that are most vulnerable for getting sick and spreading this virus is a key element. If we can get people that connect with individuals who are at risk, who are potentially asymptomatic carriers, the younger demographic, I think that that's a real key tactic that we could use to help prevent this ongoing surge that we're seeing. It's not the elderly people who are staying home and being vigilant. It's the people who may not really even realize that they're sick, and they're spreading virus inadvertently. We are seeing people for the majority of the time now in New York, having asymptomatic infections. So that just goes to show you really how pervasive this virus is and where it's lying dormant. And with antibody testing, we learned that about 15 to 31% of the population never has symptoms. So that is going to essentially carry on throughout the rest of the country. And if you're seeing a third of the population potentially without symptoms, if we don't continue to do what we need to do, we are going to see these surges. And that's definitely, going back to your question, what scares me.
How much do you think your fellow doctors want to be spokespeople right now for best practices amid the politics we've seen around this? Is that what they went into the field for, or to help people? And how much are you encouraging them to step up and speak out more?
I mean, I don't think any physician went into medicine to have to deal with the political side of this pandemic. But when there's a necessity to step in, I mean, that's our duty, whether it's this or any other health crisis. Our job is to protect, to heal, to do no harm. So if it means that we have to take a political voice, I'm all for that. Unfortunately, our voices are so small. There's not a lot of physicians who have platforms in order to communicate in an effective way to get the message out there. And like I was mentioning, who wants to listen to a doctor when you're in your 20s and you just want to be able to be with your friends? That's not really connecting. Press conferences really aren't getting the message out there that people are still suffering and getting sick. So we have to be really strategic about how we're using this. But absolutely, I mean, all of the physicians that are now dealing with these issues need to relate the reality of it. They need to give information that's going to allow people to connect, and that's going to get people to wake up. Like I said, unless there's a connection, it's really difficult to get people to understand how devastating this can be.
Let you chat with some callers. Dr. Jake Deutsch, founder and clinical director of Cure Urgent Care in Manhattan, joining us from New York this morning via Zoom. This is Susan up first out of Massachusetts on that line for those who have experience with COVID-19. Go ahead.
Good morning. Thank you for taking my call. I'm an LPN and I work in long-term care, and I tested positive back in mid-April. And luckily I had an O2 sat machine, and I was able to monitor my own condition. And somewhat about in the middle of my infection, my O2 sats went down to 82, and I was having pain breathing in. And so I called my doctor, who I never spoke to this whole time. I got a nurse at the doctor's office, and I said, my SAT is 82. She said, whoa. And I wanted to say, I'm not calling to impress you. I'm calling because I need some guidance. I need to be seen, I think. There's something wrong. Mm-hmm. And so she didn't do anything. She didn't pass it along. I never got a call back. So the next day, the condition persisted. So I thought, well, I'm not going to just sit back. I'm going to fight because there's something wrong. I know there is. My SATs were still 82, and I still had the pain. So she said, well, you can go to urgent care. So I went to urgent care and luckily saw a nurse practitioner there who did a D-dimer test on me, and it came up elevated. I ended up being diagnosed with a pulmonary embolism. So they started me on an anticoagulant. But all this time, the whole time that I've been sick and everything, I've never seen an MD. I've never seen my PCP. I've only seen nurse practitioners. I'm so grateful to the one at urgent care who thought to give me a D-dimer test, because this was a silent thing. I could have been one of the statistics, and that makes me angry that, that right now, primary care is not working for the patients. That my doctor was actually working at another urgent care intermittently, and so I never got to see her. And even when I go back for my follow-up, it won't include a CAT scan to see if the clot is gone. It won't include seeing my MD. I just feel like I'm being seen by nurse practitioners, and that's great. I know there's a lot of great ones out there, but should I be upset that I haven't seen a doctor or a pulmonologist or anything? I don't want to be a jerk about it, but I'm nervous.
I think you make a great point about advocating for yourself. I mean, during the pandemic, unfortunately, our standards of care have deviated from what we would like to have happen in terms of availability and follow-up and just what we would normally practice. And your intuition was 100% correct. When things don't seem right, you have to react on it. And, just because somebody tells you not to worry, that's where our responsibility and taking action to continue is 100% what I always advocate for patients. It's what I tell doctors too. If something doesn't add up, don't ignore it. Don't just dismiss that there's something that's a little bit unusual. Continue to follow the symptoms and make sure that you get to the bottom of the problem. As far as seeing a physician versus a mid-level nurse practitioner, I'm a big advocate for mid-levels. I think that there's many who are excellent. I see patients that come into our practice and sometimes say, I want to see a doctor. And, by the way, in July, you may see somebody who just graduated versus a mid-level who has 10 years of ER experience. So, there are some nuances to understanding what that means. But, I think it's about advocating for yourself. If it's not working out to see your doctor, you might need to be looking for a new one. But congratulations for taking that effort to do what you knew was right. I think that that's such an important message. And, during COVID, we've seen people staying at home because they're afraid of the hospitals, and other illnesses are still happening in a normal rate. So appendicitis or stroke or, just general illnesses like your thyroid being out of whack. And that's where it's important to understand that we still need to be maintaining our good health and following clues that there may be something greater going on. And certainly with respiratory problems, when things are not normal, you have to react on it. So I'm glad that you got the care that you needed. Definitely follow up with a pulmonologist. Having a PE, having started anticoagulants, especially in the face of COVID, requires that you see somebody who's really expert in dealing with the lungs and the lung function.
Most everyone probably is comfortable with taking their own temperatures. Do you think as a society we're going to have to become comfortable with monitoring our own oxygen saturation levels?
I think it seems an inevitable next step. I'm seeing devices that maybe don't actually measure pulse oximetry, but they're measuring our respiratory rate as an indicator of possible respiratory problems. I went out to dinner in New York yesterday, and they scanned us for a temperature before going in. I mean, that's the standard in other parts of the country or other parts of the world that are ahead of us. So yes, I think that these type of devices are going to become our mainstay. Wearing masks is going to be what we do for a long time. Everybody should have a thermometer in their household. I still talk with people that say they haven't had a chance to get one. It's time to make sure that you have that. And if you do have the ability to get a pulse oximeter, they're inexpensive. Some of them you can buy online, and they're maybe $30 to $50. Not necessarily the most sensitive ones, but at least an idea to say, hey, something's not right here. And I applaud the patient who noticed that their pulse oximetry went from 90s to 80s and saw that there was a big change in their condition, and that, warranted taking action.
Michael is in Madison, Wisconsin. Good morning. You're on with Dr. Deutsch.
Good morning.
Yeah, hi. I'd like you to comment on the following. Talking about pulse oximeters. COVID is a disease of the blood. It attacks the hemoglobin. It separates the iron, it ionizes the iron and separates it from the hemoglobin, and that causes a hypoxia because when the blood gets to the lungs and those damaged cells, that it cannot accept oxygen then, and so it's the reason that hydroxychloroquine works, and the same reason it works for malaria is because malaria also attacks the hemoglobin, and the hydroxychloroquine gets into the cell and prevents this from happening, and that's why you have sometimes dramatic overnight success, because after a few hours of taking the hydroxychloroquine, some patients, their iron is restored to their hemoglobin and they can breathe right away.
Michael, I'll let Dr. Deutsch jump in on that.
Well, you touch on a very hot topic of using hydroxychloroquine as a therapy for COVID. Early on, there was some studies that did suggest that it was effective, and subsequently, further studies didn't show to be as effective as we had thought. I took hydroxychloroquine because when I was sick, that was what was being recommended in the medical literature. I consulted an infectious disease specialist. There's a cascade of inflammation that happens primarily within the lung tissue, and that's where the hypoxia is primarily derived from. not being able to get oxygen to go through the lung tissue is what causes a lack of oxygen in the blood. Whether there is a cascade of other inflammatory processes that affects iron binding, affects vascular constriction, which affects other cardiovascular output, is to be determined. And I'm certainly not a physiologist to be able to comment on all of those. But we did think that hydroxychloroquine was going to be panacea. It doesn't appear to be that way. Unfortunately, nothing has been proven to be an absolute treatment that we can rely on. And that's where we're really stuck in not having any great leaps forward in how to treat this. So I appreciate your inquiry. I think that there's a lot of complexity to the situation at hand.
Wild and Wonderful on Twitter asks, has this public health crisis proven that we need more doctors overall? Many qualified applicants are not admitted to med schools due only to limits on the number that will be accepted.
Well, med school has been competitive for years. I think a lot of the crises, whether it was financial crisis or actual medical crisis like COVID, have proven that doctors are invaluable. And no matter what else is happening, our health is paramount. So yes, we could always use more healthcare providers. And it's not just the physicians, it's the physician's assistants, the nurse practitioners, it's nurses, it's all of the other skilled professionals who are part of the process, respiratory therapists, medical assistants, even the people who are administrators within the hospitals are critical. So, if we can continue to allow people to get into medicine and make it a more successful option for people's career choices, I think that that's fantastic. We saw NYU last year basically eliminate tuition in order to make it easier for doctors to get into their university. So I think that there is going to be a great change in education and our focus on how to get people in order to provide healthcare. And certainly, it makes sense. So I would hope that would be one of the things we're going to see in the future. But we need healthcare now. We can't overwhelm the system now. Thinking about what could happen in 5 years as people train through medical school is fantastic. But we need to make sure that the resources that we have now are not being overwhelmed. And that's where continuing to fight this and be vigilant and make sure that the number of cases doesn't increase at this exponential rate is where we have to focus our energy.
About 15 minutes left with Dr. Jake Deutsch of Cure Urgent Care out in New York, the founder and clinical director there. It's 202-748-8000 if you're in the Eastern or Central time zones, 202-748-8001 if you're in the Mountain or Pacific time zones. And then for those with experience with COVID-19, whether you've had it yourself or a family member, 202-748-8002. We head to Pennsylvania now. This is Thomas. Good morning.
Good morning. I was wondering, has anyone tested mouthwash with, stopping the spread? Because people cough, sneeze, and they spread the virus. Would the mouthwash actually kill the germs in the mouth?
Well, mouthwash is not antiviral. Certainly you're going to reduce some of the bacteria by using good hygiene, such as mouthwash. But, that's a fix that I wouldn't put my energy in. I would work on masks. I mean, we've seen that using masks works. I could speak to my own practice. We see about 4,500 patients a month. And since we've started using full PPE measures, masks, washing hands thoroughly, isolation and distancing amongst patients, we have not seen one of our employees that work in the practice get sick, whether it's a provider, a medical assistant, support staff. That's what works. And that's why we're seeing success in parts of the country that are using masks in a widespread level. So interesting thought. Nothing that I know that has been proven to work. But let's focus on what we do know that works, and wearing masks makes a difference. So we all have to be part of this process. Everybody has to understand this is not a violation of your civil rights. This is about a healthcare initiative. We want to make sure that you're healthy, that your family's healthy, that we're able to not overwhelm the medical system, that we get this under control And the simple process of wearing a mask, we know is effective towards that.
When a patient comes in with a severe case of COVID, what is the standard treatment that happens at your facility?
In terms of keeping things under control and protecting those around them, or just in general, how do we treat them?
How do you treat them in general?
So, basically we're assessing the patient by looking at vital signs, taking a history, just like any other intake of a problem. But for COVID, what we're really trying to understand is this patient able to take care of themselves, or do they need a higher level of care? And oxygenation, the pulse oximetry is one of those key factors. Looking at other comorbid problems, are they really ill with diabetes or kidney problems or lung problems? What does that look like in terms of potential complications if we send them home? And then certainly just understanding how they're functioning. So, if people are able to do their normal activity, they're eating, they're drinking, all of the other factors check out, whether as far as the respiratory status, then we're able to generally direct them to home care. In the evaluation process, we're obviously testing them. We're also doing x-rays whenever necessary. And then the disposition of going home is usually we add in whether or not they need some additional support, whether it's asthma type medications to help breathing, whether it's antibiotics because we think that there's a pneumonia involved. But I have to tell you this, and this is really encouraging. In New York City, where we have a great decline in the number of cases, we are not seeing people who are as ill as they were back in March. So in March, we were seeing a high number of people who were very, very ill, who had pneumonia, who we were sending home, who maybe needed to be admitted, but we were having them go home because there wasn't capacity in the critical care environment. Now we're seeing a high number of people who are very mildly symptomatic or asymptomatic, predominantly testing positive. So there's this shift as we have gotten things under control of less severe illness. So again, another highlight which we should be thinking about in other parts of the country. We have to get this under control so we can see that similar shift, because I would expect that to be the case. But if we let things just go wildly and aren't doing what we know is effective, there's a potential that we're going to see high numbers of very sick patients in other parts of the country who are under siege.
Virginia in Riverside, California. Good morning.
Good morning, doctor. I will try and make this brief. My grandson was in emergency. He got ill about a month and a half ago. They did diagnose it with the corona. They did send him home, and I had to keep him isolated for a minimum of 14 days. My question is, when he was released, the instructions stated that after the 14 days, within 24 hours, he had to have 2 negative tests showing negative. His doctor, when we spoke to him, said that was absolutely not even necessary now. Now, I'm 76 years old, and I was very concerned about my welfare as well when speaking to his doctor. He's 22 years old. He has HSP. I don't know if you know that, and Charcot-Marie Purpura. That's a kidney disease. He's had pneumonia and hospitalized that when he was younger, myself as well. So I'm just asking, what is your opinion on this?
Well, I think that it sounds like they're trying to be overly cautious, which is never a bad thing. So they're trying to determine whether or not he has turned to negative after what we consider an adequate number of time of isolation. So that's where that's coming from. Let's get a negative test. Let's make sure that there's no longer virus that's active within the body. The difficult part is that sometimes the test can pick up virus for up to 4 weeks. We've seen cases where people are testing positive for a long period of time, even though we believe that you're no longer infectious after a 2-week period. And that's why we recommend a 2-week quarantine. But the test is very sensitive. It actually just reproduces small pieces of virus. And what we believe is it may be an inactive piece of virus that's picked up, and at 4 weeks may still be testing positive. So I agree with being cautious. I think that we all should be more cautious than not. And certainly with his history, with your situation, being more cautious is more favorable than being less careful. So getting another test that tested negative would give you greater peace of mind that all of the virus is no longer in his body. But it might take longer than 2 weeks. So maybe your doctor was saying it's not necessary because of that delay, that you may still test positive. But I think but you still want to be cautious in terms of what this means to you. And it's not just your grandson, it's everybody around you. It's going to the grocery store, it's touching something and touching your mask, it's taking off your mask to have something to drink in public and somebody being nearby and coughing. So there's so many factors where we need to continue to be vigilant, and getting tested is a key. So I keep explaining to people that testing needs to happen on a very wide scale. It's not just the person who's already been positive, but it's the people that don't know their status. And we need to continue to test in order to identify infections, because the high number of asymptomatic people makes this very difficult to continue to contain where the outbreak is spreading at its greatest numbers. And testing is not painful. I have demonstrated on my videos and social media that testing actually is very simple if done correctly. And I see a number of people who are afraid to get tested because they're afraid that it's painful, which is so unfortunate, considering the circumstances of virus spreading, because we don't know where it's living. So my advice, have them get retested. If 2 weeks, it's still testing positive, repeat that in another 10 days to 14 days. And just keep yourself as protected as possible. You don't want to get sick because you're rushing to reintegrate with a family member who is COVID positive.
For folks who might be interested in watching some of those videos, where can they find them?
Go to my Instagram at Dr. Jake Deutsch or at Cure Urgent Care. I've posted them. I'll repost another one because sometimes they get buried in all the other stuff. I think that social media is a great tool for people to understand, what to expect when it comes to pandemic treatment. I've always tried to advocate for people to understand that this is something that we all need to be part of, and using tools like social media can be very helpful. I think people should understand what to expect when you're getting the test. Where can I go to get a test? How long is that test result going to take? Because we're seeing a lot of parts of the country suffering for very long delays for testing. And that could be a critical factor too. So being an informed consumer, whether it's your oxygen level is getting low and you're not getting better, or I need to know what the test is like and where I should go, is part of what I would advocate for everybody's own individual healthcare.
Time for just a couple more phone calls. This is Gary out of East Brunswick, New Jersey. Good morning.
Dr. Deutsch, you made my day. You made my day. My name is Gary Maturin. I'm 82 years old. I'm a professional in clinical research. I'm not a physician. The reason you made my day, I want to give a compliment to the leadership of the Mount Sinai Medical Center under Dr. Ken Davis, Dr. Dennis Charney, and Dr. David Muller for what they've done, not only with this virus, but the medical care they provided to me. I also want to give thanks to NYU Langone under the leadership of Ken Langone, what they're doing. And finally, I don't have the virus, but I went to my urgent care center in East Brunswick, New Jersey, and the doctors there did the nasal test, and guess what? They did the antibody. I'm not a physician. I got a couple of graduate degrees. I spent 40 years in clinical research. I'm the editor of the textbook, The Clinical Research Process in the Pharmaceutical Industry, and Amazon has tripled the price of that book. I conceived the book, 40 contributors, 30 chapters. I was the founder in 1984 of the journal Clinical Research Practices and Drug Regulatory Affairs. And I am reading the book now, The Great Influenza of 1918 by John Barry. You are doing great work. The problem is with the political leadership of this country. That's the problem. You have
you are the voice of America that everybody needs to hear. We're not done with this, and everybody that's part of this process and that's fighting needs to be recognized. And I think that we've lost that focus. And great kudos to all of the physicians in New York. I am on service at Mount Sinai. I have privileges there. I work with the doctors at NYU. It's everybody. It's every level of healthcare that's involved with this. People putting their lives on the line. People who care more about the better cause than politics. And the rest of the country needs to understand that we don't want this to get worse. We want to continue to have this improve, and everybody has to do their part here. So I agree with you. You brought a tear to my eye because we've lost perspective of what's important in taking care of this pandemic. It's become political. It's become about people's choice not to protect themselves, and we need to all be on the same page to get to the solution and continue to make progress.
Last call for Dr. Jake Deutsch. This is Brandy here in Washington, D.C. That line for those who have experience with COVID-19. Brandy, go ahead.
Hi, my experience was that I had to take care of myself at home. But one of the things that I felt really helped me was eating a lot of antiviral foods. I ate a lot of garlic. I had my liquid zinc supplement. I was drinking a lot of thyme tea and lemon balm tea. And I had my symptoms lasted for about a week. And I just want to encourage people to actually eat more foods that are antiviral and stop eating foods that feed viruses like eggs and dairy and wheat. I want to encourage people to do that because I really just feel like it helped me to combat the
Brandy, thanks.
Brandy, I think
for that.
You're absolutely right. Our digestive system has a great part in immunity, and some of the things that you mentioned, particularly zinc, are believed to be critical roles in our immune process. So doing whatever we can to help improve our immunity with natural resources is something that I'm a great advocate for. So, absolutely, people need to be taking care of themselves beyond just taking something for the fever. Good diet, vitamins and supplements that are immune supportive, I absolutely agree with. And certainly, listening to your symptoms. So I'm glad that worked out for you. I'm a great advocate for things that are simple and easy for our health.
Dr. Jake Deutsch is founder and clinical director of Cure Urgent Care in Manhattan. Appreciate your time this morning. Come back and talk to us again down the road.
My pleasure. Take care, everybody. Please wear your masks. Please get tested. Please make sure that people around you are being responsible, and let's continue to do our part.
Thank you for that. About 30 minutes left in the Washington Journal this morning. I want to show this headline from the front page. It's the lead story of the Wall Street Journal. Twitter hack hits titans of business and politics. Attackers hijack the accounts of Joe Biden, Elon Musk, and other in the firm's biggest security breach. That's what we're going to be talking about for this last 30 minutes this morning, asking you to call in. How concerned are you about that Twitter hack? Phone line split up regionally. If you're in the Eastern or Central time zones, 202-748-8000. Mountain or Pacific time zones, 202-748-8001. Go ahead, start calling in now. We'll be right back.